So surface anatomy for the shoulder, we're going to start, we want to come in and we want to first identify the superior angle of the scapula and follow down along the medial scapular border. From there, now we're going to start to draw in the spine of the scapula. And it's going to be important when we do this, we don't want to use our thumbs, we want to use our index or middle fingers, and we're always wanting to be pointing up into the bony structure that we're trying to identify. We don't want to be up sliding down because then we're going to miss it. So I'm going to come in and I'm going to identify the inferior portion of the spine of the scapula. Until we find that posterior corner of the acromion. Here. And now we're going to identify the superior border of the spine of the scapula. You will see there's lots of variability. Some are much wider than others, but we're going to follow that up here until we feel we run into a little V. And that V is going to be where we're going to palpate the clavicle. So if we come in and we don't appreciate that, we think about our clavicle being more in a ventral or anterior aspect, but it's actually, when you look at the lateral aspect, it's actually quite posterior. So here, if we palpate through the upper trapezius, here is our posterior aspect of our clavicle. So we're going to draw that in. And where the two meet is our what we call our V notch, and this is going to help us to define the borders of our AC joint a little bit later. So now let's continue with the inferior portion of the spine of the scapula. That's going to come in to our acromion, and if I just pull down a little bit, I will be able to more easily palpate the edge of the acromion. So here we are. Good. And I can follow that around to the anterior edge here, and I'm going to run into a V-notch anteriorly. So here, if I follow through, I can feel where the clavicle meets the acromion. I have a V anteriorly and a V posteriorly. And sometimes the V's tend to be more wide, some are a little bit more acute. So we're going to leave this for now, and I'm going to go over and I'm going to follow here the clavicle down to the medial aspect to help us identify the SC joint. So I'm going to turn him a little bit, and now I'm going to follow that clavicle. Here. And we appreciate how high that medial clavicle goes. It's quite high. Good. And when we palpate the medial aspect of the clavicle, what we're going to find is only the inferior half of that clavicle is going to articulate with the sternum. So here's my sternal notch. I come down, and here is where I palpate my SC joint. So just the inferior half that articulates. I'm going to draw out the remainder of his clavicle now inferiorly. So we can appreciate kind of that S-shaped curve of the clavicle. And we're going to follow that all the way to where it's going to connect to the acromion. Okay. So we've got our SC joint where our medial clavicle articulates with the sternum. We come around, and here is where we have the distal end of the clavicle articulating with the acromion. So we're going to take between the two V notches and we're going to draw a helper's line. What we find our AC joint is going to be in the anterior half of that helper's line. And what you're going to palpate, it's going to feel like a little bit of a step off here at the posterior half of that helper's line, and it's more of a ramp where we actually palpate the joint itself. And this is important to appreciate because when we're testing the AC joint, we want to follow the orientation of that joint. There is a lot of variability. Some is straight anterior-posterior, but oftentimes it's more oblique. And if we test and we find that, and we're not following the V notches, we may end up thinking it's hypomobile when it could be hypermobile. So now from here, I'm going to come back to the front, and we're going to identify several other structures. We're going to find the coracoid process. So if we come down from the infraclavicular space and we extend the patient's shoulder, we will feel that coracoid process become more prominent, and it's tender. Good. So come back. So once we find that, we're going to draw that out, our coracoid process here. Okay. Good. And then we're going to find our bicipital groove. So in 50 degrees of elevation in a scaption plane, I feel here's the anterior deltoid and middle deltoid, and that bicipital groove, it comes right under our fingers. We fall right in that valley. So here is the bicipital groove, right here. And the structure that's in between, because the greater tuberosity is hiding right now in this position under the acromion, the lesser tuberosity now is going to be palpable, and it's kind of an upside down pear-shaped structure here. So we see this is going to serve as our attachment for the subscapularis coming in. We have our coracoid process. We have our bicipital groove. Okay, so looking at it from a top view, we can appreciate here is the inferior aspect of the spine of the scapula, how that then becomes our acromion. So our acromion comes around, and then it's going to articulate with our lateral aspect of the clavicle. So this forms our anterior V-notch. When we look at the superior border of the spine of the scapula, that's going to meet the posterior aspect of the clavicle. And again, we appreciate just how thick our lateral aspect of the clavicle is. This creates our posterior V-notch. So to find our Helper's line, we draw a convex dotted line to connect the two. We find our AC joint in that anterior aspect of that Helper's line. So here we're going to palpate, it's going to feel more like a step down between the lateral aspect of the clavicle and the acromion, and here is more of a ramp, and it's that ramp where we find our AC joint.